who's also rolls his sleeves up and makes sure he's on the front line too. So thank you.
Thank you, AP, and thank you all for being here today. A lot of the inequities that existed before the pandemic continue to exist and were exacerbated by this pandemic. It is really important and crucial that today's vaccines happen where they're happening now. In this school district that's been impacted, in the south side of Phoenix that's been impacted disproportionately by this pandemic. We are grateful to the Roosevelt partners, to Dr. Boyce, to the school board for welcoming us, and for the entire team that's behind us that's making this happen. These youth are going to be able to go and see their grandparents. They're going to be able to go see their family members, something they've been craving for over the last year. So we're really excited to make it happen with all the folks that are here today. So from the bottom of my heart, grateful that it's happening in South Phoenix, that it's happening in District 8. Le quiero dar las gracias a todos por estar aquí. El día de hoy es muy importante, no solo por lo que está pasando, pero el hecho que está pasando en el sur de Phoenix. Muchas de las cosas que estaban pasando antes de la pandemia, los daños que tenía nuestra comunidad siguen presentes y ahora es por eso tan importante que esto está pasando aquí en el sur de Phoenix, en el Distrito 8. Muy agradecido con el distrito que nos ha dado la bienvenida aquí y con todas las personas que están viendo atrás de nosotros que están trabajando. Así que muchas gracias y espero más personas se puedan vacunar en el sur de Phoenix. Thank you all so much.
Well, I want to just thank Council Member and actually, you know, some folks I left out was the Phoenix Fire Department and the Adelante Healthcare that are here today putting shots in arms today. So we can't do it without those partners, as well as the City of Phoenix and Mayor Kay Gallegos, as well as all the council members that have been supportive of us in the trenches. So I want to bring up Dr. Cara Christ, Director of Arizona Department of Health Services, to say a few words here. And Dr. Christ has been at these events in the trenches, literally, for many, many times with us, and we appreciate that. Again, she'll be helping out to administer some shots today, but Dr. Christ, we're grateful for you. Thank you.
Thank you, Tomas. So today is a very exciting day for parents and children and all of Arizona. So I've been actually out vaccinating at one of our state sites today, and now I get to do it here at this amazing pop-up. And just like me, I have a 13-year-old. It's so wonderful to see the relieved parents who are coming out to get their children vaccinated. This is going to protect their kids, their community, and continue moving life back towards normal. We know that kids are not as prone to bad outcomes, but we do know that we have children who have had bad outcomes, and they can transmit it to others, and those others can be more vulnerable. So I am so grateful to Equality Health and Arizona for setting up this vaccination event, along with so many other events that they've put on over the past weeks. These community events are so important to reaching as many people and giving them the chance to get vaccinated. So we are so proud to support this one today. And just so everyone knows, it's never been easier to get your vaccine. Just a half a mile from this school, we've got a grocery store, pharmacy, and a clinic that offer the Pfizer vaccine. The Pfizer vaccine is the one that's approved for ages 12 and up. And 4 other places within 2 miles of this school offer Pfizer. So there's more incentive than ever to get vaccinated. Today, the CDC updated its guidance for fully vaccinated people. They can resume normal activities indoors and outdoors without wearing masks or distancing. So we look forward to continuing to support the work of Equality Health and Arizona Foundation, and let's all keep working towards that community immunity we're looking for. Thank you.
Thanks again, Dr. Chris, to you and your team for being right there with us and locking arms in the community. There's so many, again, as we mentioned, this is one community, so many people to thank, and we're grateful for, because it takes all of us coming together to protect our families and our community. Mr. Ray Arvizu from the Arvizu Advertising and Promotion, they helped organize and set this up and get this flowing here. Ivana Morales from Evolve Marketing helped put all this media thing, this event together. So we're grateful for for our partners for playing critical roles in the work that we do. I want to bring up next Jarvis Reddick, Commander of the American Legion Post. We have so much more to do with the American Legion. We're going to be doing many more of these events in partnership with the American Legions, again, setting up sites that we create greater access in communities. So, Commander?
Thank you. By the way, I am fully vaccinated, and I encourage everyone to do so. In the beginning, it's always a pleasure sitting here talking about the vaccinations. We appreciate Community One and the community coming out and helping out the underserved community. And again, our post is in the middle of the community, and we feel that we have an obligation to the children and youth of the community to actually do something for them, and so we appreciate everything. Thank you.
Thank you, Commander. Appreciate you. There's another physician in the House that has come alongside Dr. Christ to give shots in arms at many events. He was among the first healthcare workers to get vaccinated when we launched this, and that's our medical director, Dr. Edmund Baker. I'd like him to come up and share a few words.
Thank you, thank you. Every time you see me, I'm going to talk about diversity, and I'm going to talk about disparity in medicine. Today is no different. With yesterday's CDC recommendation to lower the age of Pfizer vaccine to 12 years old, we reached another major milestone in the fight against COVID-19. Arizona ranked second amongst states with multi-generational homes, and vaccinated adolescents will play a critical role in the protection of our vulnerable populations. We are 5 months since the start of COVID vaccination, and here in Arizona, our population, 43% of our population has received at least one dose of the vaccine. Communities of color still lag behind in receiving this vaccine. 21% of Black Americans and 24% of Latin Arizonans have received one dose. While this is a slight increase since the last time I talked to you, more work still needs to be done to close the gap. Access to care and hesitancy still are the primary reasons that disparity exists. Dr. Christ has been instrumental in helping organizations like Arizona Foundation and Equality Health Foundation in providing access points in areas like this where most people with needs can have access. Hesitancy has been the hardest to solve because of many factors that cause it, but because we must continue to educate everyone to offset the deluge of misinformation that exists. Our teens are social media influencers, and they can help spread the good work that's being done. So I urge you to help disseminate the trusted information about the COVID vaccines and continue the conversations about the importance to our communities. The summer months are approaching, and we all want to travel. We want to have friends and family over the house for barbecue. And we want to host that birthday party, to swim and enjoy life with our family and friends. This is how we do it together and as one community. Just remember, protect yourself and protect your family.
Thanks, Dr. Baker, for being on the front line and educating people, encouraging people, and putting shots in arms. We really appreciate you. And before I call up Keisha Hodge Washington, as you can tell, I'm going off of script a little bit here. I do want to bring up the President and CEO of Adelante Healthcare, because they play a critical role in vaccinating in communities. So Pedro, would you mind coming up and saying a few words, please?
Thank you, everybody. You know, we are definitely honored, and it's a pleasure to be here today. When we received the call to come out and help with this event, we were more than happy to. We picked up the vaccines. Thank you to ADHS, Dr. Cara Christ for getting us those early this morning. We immediately, you see our team behind us, the wonderful team at Adelante Healthcare, and they're always ready and prepared to come out to community events like this. I love them very much, and I'm very proud of all the work that they do. I just wanted to say, you know, thank you to Arizona and to Equality Health Muchísimas gracias por todo que ustedes hacen en la comunidad. It is very important. The work that they do in our community is extremely important. All the events that they put on, for our community, to get out there to the underserved is amazing. Thank you both for everything that you do. And this is another special honor for me personally. I was born and raised in South Phoenix, and this actually is my school that we're at today, Greenfield School. And I've worked with many teachers, Mrs. Sullivan, Maxino Bush. They named the school after her. Many of my mentors come from this area. So it's another extreme honor to be here today as the president and CEO of Adelante Healthcare and serving our community. Muchísimas gracias.
Great. Thank you, Pedro. We appreciate your team. Just to give you an idea, today we're going to be administering about 700 vaccines today. Within 24 hours, we were booked with 600 appointments, just like that. So there's an interest, there's the demand for the vaccine for children 12 and older, and that just gives you an idea in terms of what's going to happen today. We have about 100 vaccines that are available for people that walk up that didn't have an appointment today. So I'm going to bring up our last speaker and our partner, Keisha Hodge Washington, president of the Phoenix Metropolitan Alumni Chapter of Delta Sigma Theta Sorority, Inc. Keisha, thank you for being here.
Thank you for having me. I am Keisha Hodge Washington. I currently serve as the president of the Phoenix Metropolitan Alumni Chapter of Delta Sigma Theta, as well as the president of the Phoenix chapter of the National Panhellenic Association, which is more informally known as the Divine Nine. We represent the 9 Greek letter organizations here in the Valley, and we are committed to supporting communities that we serve. The vaccine has been an important important component in our service this year because we know it has not been dispersed to communities of color. So we have been really adamant about getting the word out to individuals about the importance of the vaccine. And we encourage people to get the vaccine not just for themselves, but for those that they love, their loved ones, their parents, their families, their children. We also spent a lot of time combating the negative perception that many have regarding the vaccine. Our issue has been get the vaccine based on information, based on the facts, not based on misinformation. So we spend a lot of time trying to combat that negative information. So we really encourage everyone to get the vaccine. Let's help everyone get back to normal. Thank you.
Thank you, Keisha, to you and all of your partners, your supporters. We appreciate you. Thank you. So in closing, let's make sure this is our one shot to get back to normalcy is to get your vaccine. It's safe, it's free, it's effective. And we're working with an entire community to create greater access to the vaccine, especially in underserved, diverse communities that have been hit hard by the pandemic. That is why we're here with the One Community Initiative to make that happen. So let's all take that step. And remember, continue practicing prevention, continue getting your COVID test, and get your vaccine when it's available to you and when you're ready to get the vaccine. That's how we're getting to community-wide immunity together and getting back to a normal life. And those special moments that everyone misses the most, that has been impacted by this last year together. It's been a very tough time for everybody. But there's hope on the horizon, and we're going to get there together. Thank you for being here. I'm going to stop. If there's any questions available, we'd be happy to answer any. If I can have Dr. Oh, Dr. Boyce, hold on, I'm sorry. We have some closing remarks from Dr. Boyce, superintendent from Roosevelt School District.
Thank you. I'll be brief. I'm at the end, so I just want to say on behalf of Roosevelt School District, thank you to Arizona. Thank you to Equality Health. As mentioned earlier, we are a prideful community, and we've been hit hard by the COVID-19 pandemic, but we're ready to get back to normal. We're ready to get back to livelihood. It only happens when people come out and get vaccinated, and there's been a shortage of opportunities until now. Now we have those opportunities. As a result of our community partners, as a result of our broader partnerships, we have the chance to get back to life as normal. So again, on behalf of our entire district, we are Roosevelt, Somos Roosevelt, and we're ready to get back to life and ready to get back to normal. Thank you guys for coming out to Greenfield. Shout out to all of our first responders. Thank you to our families. We love you. We appreciate you. And be bold. Thank you.
Thank you so much. I think we had a question over here.
I'll start with one. You mentioned that there's been a lack of opportunities in this community to get the vaccine. Do you have plans to expand, do more? I mean, if people didn't make it out today or they didn't know since it was such a quick turnaround, not just for teens, but for other adults in this community, what other events do you have planned to get the vaccine?
Absolutely. We're in a critical phase of the vaccination effort, and now it's neighborhood by neighborhood, door to door. So our plan, particularly with the Roosevelt School District, is to partner with them to scale and implement many more events like this across their districts and other schools and other locations. So we're going to continue to do this as long as we need to make sure that we get to 75–80% of the population vaccinated. So, and then we have other partners throughout Maricopa County that we're going to be doing this in.
How can people learn about those events? Like, where can they go to find out when those are happening?
Yeah, absolutely. You can go to the equalityhealthfoundation.org/1, and you'll see all of the events that are available to people to sign up. All they have to do is call the 1-800 number we have there, and we register them really easy. And we just made it really simple. It's a bilingual call center, real simple to register, real simple to find a site and a location. And then most importantly, we partner at a very grassroots level with community organizations and districts to get the word out. And we even do door-to-door outreach. We do flyer drops. We do use social media. We do radio. We implement all these grassroots so we can get the information out to people. Thank you for the question.
A question for Dr. Christ. Dr. Christ.
Dr. Chris. Yes, question for you.
Doctor, with the vaccine finally available for the youth now, how confident are you that Arizona is close to herd immunity? What would you specifically like to see in this next phase?
So right now, if you look at our entire population of Arizonans, we're at about 42%. Our ideal would be 70 to 80%, so we still have some way to go. But adding this additional population is going to help increase those numbers. And with every Arizonan that gets vaccinated, we get closer to that herd immunity and preventing the spread.
Do you have an expectation as far as a timeline? What would you like to see? Like, how soon?
If we keep on the current rate, we're estimating that by the fall, we should reach herd immunity.
By the fall. Okay, and one more. Your thoughts on the new CDC guidance regarding fully vaccinated people not having to wear masks indoors and outdoors. Is it too soon? And how can people be encouraged to mask up with the relaxed guidance if they don't want to get vaccinated? How do you keep people honest?
So the more people we get vaccinated, the less likely the chances of the virus to spread. But it's great news that if you are fully vaccinated, you can go about your normal activities without wearing a mask and without that physical distancing of 6 feet. I don't think it's too soon. We've given over 5 million doses of vaccine in Arizona and have vaccinated over 3 million Arizonans. So we're going to continue to add to that as long as people are, when they're with people that they may not know, take some caution, continue to physically distance. I'm still wearing my mask because this is a healthcare facility and it does not apply to healthcare facilities. But as long as everybody is, concerned about their community and taking the appropriate steps, it's perfectly fine to follow the CDC guidance.
This is for Dr. Christ. Hi. So I just have a question regarding vaccines in schools. We're in a school right now. Lots of families excited about this. The COVID vaccines, do you foresee, will they be mandatory in schools at any point?
So right now, our vaccines are approved through an emergency use authorization. So that's not something we're discussing right now. The department does set those school required vaccines for school entry. We are not talking about adding COVID-19 vaccine to that at this time.
Will that change once there's full approval?
We would have to take a look and see what the ACIP recommendations are and what the proportion is of vaccination. Like, we don't require flu vaccine at schools. If this is more like a flu vaccine, then we may not require it for schools. But that's a discussion for way down the road.
Okay. And then just regarding the guidance from the CDC with the masks, what would your advice be for businesses that might be kind of struggling to have their patrons wear masks in their businesses?
So what would our advice be to businesses who like have employees?
Yes, yeah.
What we would recommend is to make sure that you have policies that reflect, if you know that a majority of your employees are vaccinated and can follow the CDC guidance for fully vaccinated, then we would say absolutely follow the CDC guidance. If you know that you have a majority of your employees that aren't, we would still recommend having a mask policy in place, because you want to protect those individuals that aren't vaccinated. Those that are vaccinated are fully protected.
So we're at this event today. What else is the department doing to make the rollout equitable in communities across our state?
Yeah, so I know we've been working very closely with Equality Health and Arizona and multiple partners in the community to make sure that they have the vaccine needed. We've also been working with our county health departments, because as you'll remember, Pfizer, which is the vaccine that's approved for now 12 and above, has very stringent handling and maintenance requirements. So we've been working to make sure that every county health department, if they want, has the deep freezers, has the ability to store and to administer, so that everybody in the state has access to the Pfizer vaccine.
Any other questions? All good? Okay, thank you so much for being here. And let me know if you have any requests for any interviews with any of the partners here. So we'd be happy to accommodate. So thank you, partners, for being here. Hats off to you all and to all our families and the students that are here taking this very important step. Thank you.